So guys, kindly, if you're there and you're just seeing us, remember, kindly consider subscribing, like, comment, and share it to your friends, guys. Today we are in the home village of Ross Kunix. And just by the title, guys, kindly, just wait for us to talk to you about it. Yeah.
Yeah, guys, welcome to this live stream. Hope you are getting us very clear. If you are getting us, kindly let us know. If you are seeing us very clearly, kindly let us know. And as you join the live stream, hit that like button and just comment. Let's converse and get to know more about this video, guys. And as you can see, I have the girl here.
Miss Dosha.
Yeah, kindly go check her channel and remember to subscribe. Let's support each other, guys. You can imagine she's here for me. As you can see the title, she's just here to comfort me, guys. Yeah, I know there are few people who can do this, but she has really committed herself. She has sacrificed and she is here with me, guys. Yeah.
So guys, kindly, if really you're already watching us, kindly let us know if you're there with us. Let us know. Yeah, whoever is there, please let's know. Yeah, drop a sweet comment. Let's know where you're watching us from. Yeah, and today we are talking about the mother to Rose Kunix, and actually she's left us, and actually her soul is resting in eternal peace. Yeah, so let's support our girl by consoling our girl. Yeah, this is the time we will know the true friends, Rose. Yeah.
Yeah.
And actually there is actually a change. Yeah. And I was just telling Rose that my father died recently, actually 6 months ago, and for sure it is really a change. Wow, I am, thank you so much. I am, thank you so much.
Yeah, if you are in this live stream, kindly give this video a like and let's converse. Let's know more. Let's know more about my mom. She has just left me, and I know it's very painful, but it is part of life and we
Yeah.
need to accept.
Yeah.
Yeah, so we are here just to tell you more about this title. And if you are joining the house, kindly give this video a like. Yeah, I can see Casta.
Casta, I'm so sorry. Thank you so much,
Thank you,
Casta.
Casta.
Condolences, dear Rose. Yeah, that is, I think I'm not seeing well. Okay. Thank you so much for coming along. Actually, I know so many people are asking themselves, you are in Turukana. Yes. Yesterday night, I heard that my friend has lost the mother, and I had to come. Yeah. My condolence, Sally. Thank you so much.
Lee
Pole.
David, thank you so much.
Yeah.
The Emocioma Show, thank you so much. Thank you so much for joining the live stream. For those who are joining right now, kindly hit that like button. Yeah.
Mom Ellie, my condolence. May she rest in peace. Thank you
You.
so much. Thank you so much. I saw it was very good for me to leave Turkana and just come to be with her. Actually, she's the youngest, yeah, in the family. And actually, I thought maybe it is good for a friend. She's actually visited me in Mombasa, and it is good for me to come also and just visit her and just to be with her. So today I'm actually spending my day here. And actually, guys, if you're near, you're welcome. Yeah, you're welcome. You can
Yeah.
visit.
Yeah,
Yeah.
thank you so much, guys. As you can see, she has traveled all the way from Turukana. Yeah, she had left Mombasa and went to Turukana. But yesterday, when she had this information that my mom has died, she just sacrificed that. Let me go and be with Rose. And she is here right now. At least I can feel some relief. At least I can feel I have a friend.
Yeah.
Yeah, I know there are other friends who value, but maybe you are committed somewhere. But thank you so much, Miss Dosha, for making it to
Welcome.
be in my village. Yeah, today I just want to share with you a story of my mom
Yeah.
and what happened and why she died.
So Ross, maybe I can, if I can really ask you, when did you diagnose mom, and what was wrong with mom actually. Yeah. Maybe she can just tell us and explain to us how mom was suffering from. Yeah.
Mimi Bree, thank you so much.
Hugs,
I
honey.
really
I wish I
appreciate.
was not doing my exams. Okay. Thank you.
Yeah, so my mom started, okay, she has died from just sickness. Yeah, my mom started being sick. I remember last year, October. That's when she complained that she's feeling unwell, and we just thought that maybe it is just a normal sickness and she's going to be okay very soon. Yeah, so we took her to a hospital, to a nearby hospital. Yeah, she got treated, but when she was diagnosed for malaria, I remember, and typhoid, and they told us that there is no any disease found. Yeah, so we asked ourselves what might be the problem with our mom.
Yeah.
But after some time, they gave her some drugs which she used, and she got better at least. Yeah, so that's how the disease started.
So the first time the mom was diagnosed with typhoid and malaria, yeah, and actually you've came along with your mom until to date, isn't it? So
Yeah.
eventually, what did the doctors say?
Okay, the doctor said that after using the drugs that she was given, she will be okay. Yeah, and after that time, she felt okay. And for us as a family, we felt like our mom is now okay, and we are just a happy family. But this year on February, yeah, I remember this year, February is when she started complaining again, because recently she was complaining about the knee pains, yeah, the joint pains in the knee, and on February it became worse. Yeah, so we had to take her back to the hospital.
Yeah.
Yeah, we had to take her back to hospital so that we can get to know what the problem is, and we decided that maybe we can change the hospital so that maybe the doctors can say something else. Maybe
Something more. Actually,
yeah,
you are thinking maybe there is something they're not talking about, isn't
yeah,
it?
yeah.
Yeah.
So
Let's know on the comment box if really actually you've ever experienced that. Yeah, doctors taking you round and round and round, yet it is your most beloved one suffering. Yeah, and how did you feel it? Let's know on the comment box, guys. Yeah, and actually you'll bear with us. Remember, people are so many, yeah, in the compound, so maybe the noise that might be coming along, kindly just bear with us. Yeah.
yeah, so guys, on February we took her again to the hospital. She was really complaining about the knee pains. So we had to take her back, and she was again diagnosed. But they just told us that maybe she has malaria and typhoid again. So she was given drugs again, and
Yeah.
we came back home.
Yeah.
So
Guys,
feel
let me take the baby. Liz, thank you so much.
roll with Liz, thank you so much. I really appreciate, dear. Yeah, for those who are joining the live stream right now, kindly hit that like button and let's converse. Let's follow this story for those who want to know more about my mom.
Oh, thank you, Rodrigue Liz.
I'm here today.
Mimi Bree. Oh, let me hope I'll read
Thank you so
your
much.
text. Thank you so much. Actually, remember, I'm from Turkana. I had the news yesterday. That is what, for those who are just joining. And actually, I tried so much so that I could come immediately to be with Roscoe Nix. Remember, we've done some videos with Roscoe Nix. Yeah, thank you so much. Actually, she is strong. Yeah, for sure, she's very, very strong. And Roll with Liz, I want to thank you so much for really coming along. I remember when my father died, Roll with Liz was there in my stream actually. And thank you so much. We want to really, may God bless you a lot.
Yeah, roll with Liz. Thank you so much for the support that you've shown me. Actually, you are one of the friends I can testify that we've never met in person, but let me hope one day I'll meet with you. I really appreciate for the support, for the advice, for everything that you've done to me. I really appreciate so much.
So Emma says, Pole Sana, thank you so much. I thank you so much. We really appreciate you. Yeah. Remember now we want to know the real story of the mom. Yeah. Actually, yeah, we'll meet someday. Actually, Ron will really needs to meet you. Yeah, it is very true. We really need to meet you too. Now, guys, we really want to know the story. They have come along. Remember, the mother was diagnosed with typhoid and malaria. Then they came along. Actually, they were being taken around and round. Yeah. And I think for sure that is not really good. But then anything happens. Yeah. You know, when you have sickness in the home, actually you have to expect anything. But now they did not actually give up. Imagine they had to go with their mom round and round, and today actually, so eventually what was your mom diagnosed with?
Okay, for the second time that we took her to hospital, she was again diagnosed of typhoid and malaria, and she was given the drugs which she used, but she never saw any change. Yeah, so the situation was worsening, and after that she started complaining of her throat. Yeah, she was not swallowing the food. When she swallowed anything, she could just vomit immediately. So we had to act immediately because we knew something wrong is happening.
Yeah.
Yeah, so we had to take her to the hospital again for the third time to know what might be the problem with the throat,
Yeah.
because she was vomiting and she was not eating.
Mm-hmm.
When she eats, she vomits.
Yeah.
Sometimes she complains that when she eats, the food will get stuck in
Thank
her
you, Roll
throat.
with Liz. Thank you so much.
Yeah.
Yeah.
Yeah, so sometimes when she eats the food, she will tell you the food has stuck in her throat. So it forced her to vomit very, very rapidly, and the throat became
Like,
swollen.
yeah.
Yeah, so we went to hospital for the third time, guys. I tell you, it's very painful.
Yeah.
Yeah, very painful. So when we went to the hospital, he was told to go for an x-ray. Yeah, and they did an x-ray on that day.
Yeah.
Yeah, on that day we went there. So when they did an x-ray in her chest and the throat, they found that her gullet, the gullet or the esophagus had it had blocked, or it had coiled.
Yeah.
Yeah, it had coiled. So when she took the food could not go straight to the stomach, but it could stuck in her throat. So the food that she could eat to get inside her stomach was the porridge, the milk, just the soft drinks, but the hard food like ugali, rice, she could not eat. So we just knew that our mom is going through a
Joseph, thank you so much. Actually, I'll give Ross a break. And for sure, guys, okay, with Ross, I know she's really in pain, and you'll bear that whenever she's not able to talk, I'll be talking. Yeah. And I really need your support for us to just go on with this stream. Yeah. For her, kindly, and I want you to share this video to your loved ones, yeah, to your friends. Kindly do it for her. And guys, kindly consider subscribing if really you're new to this channel. And guys, for sure, her mother, okay, somebody is asking, does she have a dad? No, she does not have a dad. Actually, she was only left with the mom, and right now she'll be relying on the sisters and the brother. Yeah, they have only one brother. Actually, she'll be sharing her biography, and later that one is on another video. And for sure, right now she's an orphan. And let me tell you guys, yeah, God is a God for us. Yeah. And actually, if you're near, you can come. Yeah. Let's console our girl today. Yeah. This week we have just to walk along with her for sure. Yeah. And for prayers, you can really join us and just pray for her. Yeah. It is very good. Yeah. Roll with Liz. Oh dear, yeah. Thank you so much.
Chepo's
Me,
Kitchen.
yeah.
Welcome to the live stream.
Thank you,
Yeah,
Chepos.
for those who are asking if I have a dad, I lost my dad when I was very young, when I was 5 years old. Yeah, I lost my dad. So I have been staying with my mom, and she has been there as a dad
Yeah.
and as a mom. But right now, I'm a total orphan.
So, guys, since Rose was 5 years old, the mother has been taking good care of her until to date when God decided that actually it's time for her to go. Yeah, actually, she lost the mother yesterday. Yeah, yesterday at around 5 p.m. Yeah, East African time. And actually, guys, I had that, and for sure, I really needed her near me. Yeah. Cloud, sorry, Rose, stay strong. Yeah, kindly
Thank
stay
you.
strong.
Yeah,
Yeah,
guys, I promise you I'm very
yeah.
strong.
Actually, she's very strong, and actually, she's the one who has told me kindly accompany me on this live stream. I want to talk, and I'm sure by your support, she's going to talk and tell us. Yeah, we are really going to support our girl here, and she's going to do very well. And guys, if you've not subscribed to this channel, the most love you can give to this girl, the most condolence, is just to subscribe, drop a sweet comment for your girl, and like the video, guys. Because when you like the video, I'm telling you, they will really the YouTube guys will be able to at least suggest the video to many people. Yeah.
Okay, I can see Mimi Bri is saying I update you about the burial.
Yeah, we
Yeah, I
will.
think I'll update you. Yeah,
Yeah.
I'll be updating you guys.
Yeah.
Since my mom passed on
Mhm.
yesterday, we are still arranging.
Yeah.
Yeah, so I'll be updating you guys.
Yeah.
Yeah, so after the x-ray, they found out that my mom's throat had blocked. She had some
Hi.
blockages.
Hmm.
Yeah, she had some blockages. That's why the food was not going direct into her stomach. Yeah, so they referred to us, or they gave us a refer to go to a big hospital where a certain test was to be done in her throat, that is biopsy, for those who know. Yeah, so we went back home after that x-ray, so we had to look for money because that test needed money. Yeah, the biopsy test, it needed money, and we had to go back home,
Yeah.
look for money, and go to the hospital which we were referred
Yeah.
to. Yeah, so we tried our best, we got the money, we went to that hospital, we told them, we explained everything. They gave us a letter which we just presented there. But guys, in this world, you can go through so many challenges before you get what you want. I tell you, when we went there for a biopsy test, I assure you guys, it was not done. They told us that we need to go back home, and remember, the patient was just worsening. They told us to go back home first, and they said we need to do some tests first
Yeah.
before we do the biopsy which they had referred us. So we had to book other tests, and they also say that we need to prepare the patient because we can't just go there immediately and they do the test to a patient.
Yeah.
So they needed to prepare the patient psychologically that she's going to undergo an operation. Yeah, so we had to prepare the patient and we had to book other tests. So we booked. Yeah, we booked. And I remember that day we had just carried the money for biopsy tests only. So when we reached there, they said that you need money to book other tests. So we requested friends who were good to us. They gave us money. We booked the test and we went back home. But my mom, who has passed on, heard that the doctors want to do an operation, but she said if it is an operation, it's better I die. It's better I die. But
Guys, her number is on the description box. She's already shared. Yeah. Her number is on the description box. And thank you so much, Diana. Thank you so much. And I want you guys to come along and just support her kindly, so much. Have have to prepare for work, my dear. Thank you, Roll with Liz. Thank you so much. Really appreciate your time and have a good time at work. And guys, really, I really want you to support me on this. Let's just be here with her. Kindly roll release. We thank you so much. Enjoy your time at work. We thank you so much. Miss Dosha, I really appreciate for coming to give her support and strength. God bless you. Thank you, Chepos. Thank you so much. And actually, the way you're supporting me, we really like it and we love it all, guys. We really love it. Thank you so much. Dosha, some people don't know what description box is. Oh, okay. Sorry about that. Actually, what can I say about it? There is there is where we put just beneath the title. I don't know the layman's language. Just beneath the title, yeah, beneath the title. Actually, when you hit there, there is always details of the YouTuber. She's just wrote about the video, what the video is all about. Guys, kindly go if you want to really donate. Please go to her PayPal. There is M-Pesa. Please do so. Yeah, please help me copy it. Thank you so much, Brie. Thank you so much. May God bless you. And actually, guys, today we are talking about the mom to Rose Kunix. And actually, if you're just coming right now, joining us right now, she's lost her mother. She lost the mother yesterday at 5 East African time, 5 p.m. That is. And guys, actually, I know so many people who know me. I was in Turukana, and actually, we have come to comfort our girl. Yeah, she has good. Brie, thank you so much. So Brie has really helped us. She's shared with us there. There is her number. And actually, guys, just support her. Yes. And actually, the mother was taken to the mortuary yesterday. Yeah. She died in the house. Yeah. So let her just continue and telling us the story, how it was. Yeah. Sorry, that is Wilfrida. Sorry for the loss, Miss Dosha. Thank you for the support. Thank you so much, Wilfrida. Yeah. So maybe the mother was to undergo the biopsy, and actually when she was to undergo the biopsy, you remember the mother said, yeah, if it is operation, better she dies. Yeah.
Yeah.
Actually, she was not ready for it, and actually, if you could see her, she was not strong for that. Yeah. And
Yeah.
sometimes it's good when you know your heart does not want, it's not ready to do something. Actually, sometimes it's good, it's better for you not to do that. Yeah.
Yeah.
Thank you so much, Chebet. Sorry, darling. My sincere condolence to you and the family.
Thank
Thank you
you.
so much. Thank you
Thank
so
you.
much.
For those who are joining right now, kindly give this video a like and I will appreciate. Yeah, so by that time, my mom said that I'm not ready for the operation. But remember, we had booked other tests, which we were told. I remember it was CT scan and cervical screening. Yeah, we had booked those tests. So we went back home. You can imagine we were not given any drugs there, and the patient was getting worse. And she said she don't want an operation. So we went outside with our mom and we asked her, now if you have said that you don't want an operation, what can we do to you as a family so that you get better? And she said that maybe I can just try the traditional herbs. Maybe they can help.
So, guys, let me know on the comment box if really in your village you use. Remember, Ross is also a village girl. If you've not watched her videos, if you're new to this channel, guys, so let me know in your on the comment box if really you use herbs. Remember, the mother said she really wants the herbs, and actually, let me know how powerful they are in your village. Yeah. So, Ross, tell us about it.
Yeah, so she said, if it is an operation, I'm not going to do it. Maybe I go and try the traditional herbs. And we said, if my mom's faith is in the traditional herbs, maybe we can allow her. Yeah, because even if you believe this thing can heal you, if you have faith in this thing, it can heal you. So we said maybe our mom has faith in the traditional herbs. She went for them, so we came back home. She planned. She went back. she went to look for the traditional herbs. And I tell you guys, we spend a lot of money in the traditional herbs. I tell you, these people are liars. They lied to my mom. They gave her the traditional herbs, which were just lies. Those herbs didn't help. I tell you, they didn't help in any way. And
Yeah.
we spent around 100,000 just on traditional herbs. We sold our cows. We did everything.
Actually, when Ross talks about selling their cows, yeah, actually they have sold all the cows in the village. Guys, it is so painful, and I'm just hoping that everything is going to be okay. God is on our side, I know very well. Thank you so much, Shepos. Mora is telling us uh, take heart. Thank you so much, Mora. Thank you so much, B. Sorry, dear. God is in control for sure. God is in control. Actually, they have no even one single cow. They've used all any coin they had in their pockets. They have used it, and I'm bearing a witness. By the way, the whole family have used everything, all the resources they had, they've used everything. And that is why, I knew about the illness of the mother, and she's actually been updating me about it, and we've been helping each other just to console each other, visiting doctors, them visiting doctors, they really needed an encouragement. And actually at this moment when God has to take the mother, we feel so sorry, and it's like, a mother to me also. Yeah, that one is so painful. Yeah. And actually Rose is here today, and they've already shared her number. Yeah, kindly, if you really want to support her, please just do so. Yeah.
Yeah, for those who are joining the live stream, kindly give this video a, a like. I can see, who is that? Dama. Yeah,
Bazon,
thank you
something
so
of the
much.
sorts. Yeah, let me hope I've really I've said your name well. Yeah, I've pronounced it well, Bazon. Let
Yeah,
me hope.
guys, we sold our cows for our mom just to get the traditional herbs that she was told, because the doctors who are dealing with the traditional herbs requested for a lot of money. Yeah, so we had to look for that money that they want, and we say that if it is going to heal our mother, it's better we do it.
Yeah.
Yeah, so we sold them for our mom to get better. But guys, I tell you this, our mom got worse. Yeah, so after using the traditional herbs, even before using the traditional herbs, after the hospital, she was to undergo the biopsy, the CT scan which we had booked, and the cervical screening, because she had started complaining about the stomach also. So if there was a problem with the throat, the doctor said there must be a problem in the stomach too, because after some time she started bleeding at her age of 62 years, guys. She started bleeding, so we knew there is a problem in her
Yeah.
stomach.
Yeah, for
Yeah,
sure.
that's why the doctor said that she has to undergo the CT scan and the cervical screening. Yeah, but she refused. So we said, let's do what our mom wants, and we gave her money. She went for traditional herbs, but all was in vain. They just lied to her. They gave her the drugs, but those drugs even made the situation worse. Yeah, her stomach started swelling. If you could see her,
Actually, Rose saying you could think she's pregnant. Yeah.
yeah, even
And
pregnant for twins.
yeah,
Yeah, a mother of an age of 62.
imagine an age of 62.
Yeah, my
Yeah.
mom, the stomach had swollen, and she was losing weight each and every day because she was not eating. Yeah, so after the herbs, I think they worsened the situation, and we said this is bad. So the next step we did is we went to a nearby hospital again, and they told us, go back. You can imagine, guys, we went to a different nearby hospital, but they told us to go back where the other hospital referred us to. So we had no option. We went there, we went back to where my mom refused to be done an operation. Yeah, so when we went there, we started a fresh process. You can imagine paying money again, booking the tests again, the CT scan, the what, because they said if you are coming again, you are a new patient and you are going to start afresh. So we started paying the money again. So she accepted for the CT scan, it was done, the cervical screening, it was done, and the doctors of that hospital told us that the ovaries, my mom's ovaries, one was larger and one was smaller. So they advised us that at her age, the ovaries should be smaller,
Yeah.
not larger. So one of they told us, according to the hospital report, they say that one ovary was larger than the other.
So, guys, let me know actually, is that cyst or what is it? Or actually, she was explaining to me, and actually, I thought maybe ovarian cyst because it's the one which swells and it becomes big. So, I thought maybe they're saying that. And thank you, Diana. Actually, we are really on support of our girl here. This is just a great moment that God has made, and actually, we have to be there for her. Yeah, actually, yes. Sometimes doctors can really be stubborn, and not all of them. Some of them, they were genuine to them, by the way, and they could open up and tell them everything about their mother. Yeah.
Yeah, so they told us that the ovaries one was larger and at her age it was not normal. So they had to do an operation. And remember, the first operation in the throat was not done. Yeah, so we saw the stomach was worsening, and the doctor said that maybe we leave the throat operation a bit and do the stomach operation. Yeah, to remove the ovary which was large. Yeah, so guys, we needed money to do that operation for the stomach to remove that large ovary. Yeah, but we went home to look for money because we had no enough funds to do that operation, guys.
And actually, guys, when Ross Kunix is talking like this, remember she's a student, a fourth year student at Moi University, Eldoret. And actually, guys, remember she's been a YouTuber, yeah, posting frequently, and all of a sudden she just stopped. Yeah, that one can tell you why she actually stopped posting videos. And guys, even if it were you, you could give it a silent, give it a break and just focus to your mother. Every womb of a mother, it's just precious. So actually she was really appreciating the womb of the mother that carried her for 9 good months. Yeah, so she had to just take a break and really appreciate that moment and observe the mother very keenly. And remember, she's the youngest actually, so she had to take good care of the mother, and that is why she was not even at school. Yeah, actually she went to school. You went at school, isn't it?
Yeah,
And
but
she
I
came
came back.
back. She could not even settle at school, guys. Yeah.
Yeah, so guys, they told us to go home, but first, remember, they said we leave the biopsy test, yeah, the operation at the throat first, and we do the stomach operation first because they saw it was worse. It was worse than the throat one. So they said we prepare and do the stomach operation. So after the herbal drugs, my mom saw it's better to go that operation even after refusing for the first time. But later she accepted. So that's why we went back to that hospital and they said she has one ovary which is larger and the other one which is smaller. And we managed, we booked a date for an operation. They even gave us a letter and a ward number. Yeah, a ward number and a letter and and a date.
Yeah.
Yeah, and I promise you, they told us it was on a Wednesday. We went to hospital where when they told us that on Monday an operation was to take place. Yeah, so there were some tests, some blood tests that were done, and we were to collect the results on Friday with
Yeah.
the COVID test results. So it means we did the tests on Wednesday, the COVID one and the blood tests. Yeah, so on Friday, my mom was at home, and on Friday, I went back to that hospital to pick the results. Oh, when I reached there, the doctors were just telling me, "We can't see the file of your mom, but we say that we paid. You told us to come on Friday to pick the results so that on Monday, my mom, on Saturday, she was to be admitted, and on Monday, to undergo the
Yeah.
stomach operation."
Mm.
So I went on Friday to collect the results, but in this world, guys,
I'm telling you, they took them round and round. And actually, it was Ross who went to take the results. And actually, she was not able even to get the results. They took her round, and even it was like they don't know even her now.
yeah,
Yeah.
but I remember when reaching there, I personally, with the doctor, we started checking the files. Even the patients were outside, but the doctors told me, "Come inside and help me check the file of your mom." We really checked the file. There was a bunch of files, but we couldn't get my mom's file.
Yeah.
And I asked myself, why is this happening to my mom? Why? We have come to this hospital so many times, but they keep on referring to us. They keep on postponing things.
Yeah.
So that day when I went to collect the results, they told me that they can't see the file. And they said maybe I can go to the ward to check if the results were there. Guys,
Yeah, actually, I was is saying a lot of time was wasted. For sure, even when she was telling me the story, a lot of time was wasted at a certain hospital. We don't want to mention the
yeah.
hospital, yeah, for just security purposes, but actually, there was a time that was wasted, and there was someone who just neglected a job somewhere also, yeah. Though, yes, it was a chronic disease, but though maybe it could be 1 day or two, still we could be with our mom right now. But then really God knows about it. Yeah.
Yeah, so guys, on that Friday, I said the doctor said that we can't see the results, and I told myself maybe I can go to the ward, which my mom was to be admitted on Saturday. I went there and I just told the nurse I want to collect the results for my mom, and they didn't even believe me. But I had the patient's card number, which was already in the system. I don't know why they couldn't believe that I was the daughter to that woman. Yeah, so I told them that is my mother, and they asked me, "How can we believe that she's your mother?" And I told them I have the card. Even if she's my guardian, I have the card of the patient. You can log into the system and check if she's one of my.
So remember, Rosewood was with the mother in the hospital. She's been taking good care of the mother in the hospital. And actually, going back to look for the results, they even don't want to tell her now. Now, some of the medical staff, they want to pretend that even they don't know her. Yeah.
Yeah.
So that one is so upsetting for sure. Indeed, that one is very, very much upsetting. But we want to appreciate for those few staffs. Yeah, in that hospital who needed to open up to Rose, yeah, and just tell her really, because there are some of them who opened up, yeah, Rose, isn't it?
Yeah.
And really told her the truth and just told her now, yeah, let her tell us about it.
Yeah, so I decided maybe I go by myself to the ward to collect the results, and they gave me the results. But before that, the doctor who was telling me that she can't see the results, she said that she knows my mom. You can imagine in a big hospital, a doctor saying that she knows my mom. So she knows my mom, but the results for my mom are not being found. How? How? So I asked myself how. And she told me to sit there even before going for the results in the ward. So I seated there waiting almost for 30 minutes. She's not coming back. And I told myself, maybe let me go by myself and check. As I was going, I met her on the way, and I asked her, "Have you found the results?" She told me no. She told me no. And I asked her now, "Where is the ward?" She told me, "I don't know. You can ask."
Imagine a staff saying she doesn't know the certain word that she's looking. You know, the words are named, they have names, yeah?
Yeah.
So she was looking for the specific word because Ross knew the name of the
Yeah, so we
word.
had the letter.
Yeah.
which my mom was to be admitted on Saturday so that Monday operation was to be done.
Yeah.
Yeah, and you can imagine a doctor who has been there for years telling me that she can't even
She
recognize
doesn't
the
know the
word.
word.
Yeah, and I told her the name of the ward which my mom was to be admitted. And she said, I don't know. Even after telling me to sit there and wait for the results. So as I was going, she just told me, go and ask. I don't know. So as I was going, so many questions were running in my mind. What might be happening if a doctor can tell me she doesn't know where the ward is?
And remember,
So,
at this moment, guys, they have just sold everything.
yeah, so
Almost everything in the home that is called property, yeah, they've really sold it, yeah, for their mom, yeah. So it is quite so. Anyway, may God just handle that, because we don't want really to judge Ross, but we just want to say, God, may God see that, yeah, whatever happened with that stuff, let God handle that, yeah, because actually God has already taken mom, and we want to just give praises to God and say, God, may her soul rest in eternal peace. Yeah.
yeah, so they told me. I went there, I found the results even after questioning me, who are you to this patient? I told them I have the patient's card. You can even log into the system and check if she's there. Yeah, but they gave me the results after telling them the patient is my mom. They gave me the results, and when I went to pick the results for COVID, I don't know, guys, what to say.
Yeah.
Should I say it?
Yeah, just say it.
Yeah, so when I went to COVID's room to take the results because my mom had been tested for COVID, you can imagine, guys, they told me my mom is COVID positive. COVID positive. So,
So, guys, things were contradicting, yeah?
yeah,
Ovarian. I want to know on the comment box if really you've had this contradiction of what your really loved one has been suffering from COVID, ovarian, let me know kindly. And somebody was telling us maybe it could be uterine something, cancer or something. I really don't, yeah, I think it is I was telling us. Okay, she
I
was just
am.
suggesting.
Thank you, guys.
Thank you so much.
Yeah.
So, guys, actually, this contradiction, how comes it really happens?
They
Yeah.
have told us to go to the ward. They have even told us the date and the time, even the ward number. But on the date of picking the results, they told me my mom is COVID positive. And I knew if you have a guardian or any person around you who is COVID positive, you are also affected.
Yeah, for
So
sure.
for me, I didn't want to go. I asked the doctor, now the patient is very worse. The situation is worsening. What will happen? Because you told us on Monday she's undergoing operation. Now you are telling us the operation can't happen because she's COVID positive. She's not eating, remember? Her stomach is swollen. You can remember that, guys.
Yeah.
The patient is losing weight each and every day. Yeah.
Thank you so much, Guracha. Thank you so much. Yeah.
Yeah, thank you for joining. Yeah,
Yeah.
so what I did after they told me my mom is COVID positive, I was I was shocked, and I walked very slowly. I didn't want to walk very fast. I walked very slowly because I knew if you have a person who is COVID positive, you are also taken to the quarantine center. So I
Yeah.
was waiting to be taken. And you guys,
Actually, Rose is so funny at this moment. What she says, because they say the mom is now COVID positive, she decided she has to go round and round that hospital so that they can just pick her.
yeah,
Yeah.
I was waiting for them to pick me
Yeah, for
because
sure.
if my mom is COVID positive and I've been staying with her, and maybe I'm also COVID positive.
Mm.
So I stayed there for some minutes. I was just waiting for the doctors to come and pick me. But they were not even bothering me. And I asked myself, how can that happen? Even the doctors are associating with me who is COVID positive.
Okay, Bree is asking if it is a public hospital. Actually, this journey of the mom has been so long, yeah? And
Yeah.
actually, they've been walking from one hospital to another,
Yeah.
and it has been public and private hospital together. Yeah.
Yeah, we've
And
gone hospitals.
yeah, so many hospitals, and
Yeah,
actually
and
some
this
were
one,
friendly, some were good.
this one, it was the biggest hospital.
Yeah.
And whenever you could go to a smaller one, they would refer you to that
this
big hospital.
Yeah.
So I remained there for some time so that they can pick me, because I was staying with my mom and I knew maybe I'm also COVID positive. They didn't. They were just asking me questions about how is the patient. You can imagine that after the doctor telling you your mom is COVID positive, he's now laughing and telling you that now how is the patient? How is she doing? Even me explaining to him that she's like this, the situation is worse. Maybe she could just have mercy on my mom. But the doctor was just saying that go feed her and come back after 3 weeks for COVID retest. So she said the operation will not be successful. I cried. I
Yeah.
cried. I cried as I waited for them to pick me and take me to isolation center, but they didn't. So I went back home, and we didn't want to disappoint our mom because she knew on Monday she was going to undergo the operation since she had accepted.
Remember, the mother is now the mother has already accepted that she's
Yeah.
going for the
She
operation.
was psychologically prepared that on
Yeah.
Monday, on Saturday, I'm going to the ward. On Monday, operation will be done to me. And she was ready, guys. My mom was ready.
Victor, thank you so much. Thank you for your prayers. We really love you. Thank you for coming along. And kindly, if you're new to this channel, consider subscribing and just drop a sweet comment for your girl here.
Yeah. So when I came home, I shared with my siblings. I told them how they said, and they didn't believe it. So we didn't want to disappoint our lovely mom since she was suffering. So we had to come up with a good reason of convincing her, so that she knows on Monday she'll not be going for an operation. So we had to tell her that the results were not out. Yeah, that's what we told our mom. Yeah, we just encouraged her. Yeah, just to wait for the results. But
so with Ross family, they thought maybe they will sort the issue with the doctors, and eventually the mother will undergo the operation, because now they didn't want to tell their mother other things, yet she has already accepted what they have been fighting for, to accept the operation. Yeah.
Yeah, so we just told her that the results are not yet out. Let's wait for the results. But guys, that night, my mom didn't sleep because she was getting worse. The situation was worsening. She had lost weight. I remember she was about 40 kgs. You can remember. You can imagine that. Guys.
62-year-old having 40 kg. Yeah, guys, let me know kindly in your village if you really have such kind of people, if anybody of your loved one has really passed through this. And actually, for sure, we have to put them into prayers at this time that we are really, really mourning. Yeah, we really need to put such people in prayers. Yeah, let's remember all of them who are suffering from all chronic disease. Yeah.
Yeah, so guys, after coming back from the hospital on that night, we didn't sleep. Our mom didn't sleep. She was restless. She was feeling bad. Yeah, so she just picked the phone and called my elder sister and just told her, just try as much as you can. Come and pick me, take me to any hospital. That's what she said. Yeah, those are the words what my mom said. Just come.
Now she was talking to the eldest sister of Ross.
Yeah, she just said, try as much as you can. Come pick me and take me to any hospital. Yeah, so in the morning, so the following day in the morning, it was on a Saturday, which was meant for her to go to the ward. But since things were not good, we took her to a hospital which we had gone earlier. Yeah, and in that hospital they had referred us to that big hospital. So we went back there. The doctor said, when they looked at the sick person, they said, "Oh no, just take her back to that big hospital. So they gave us a refer again. And we said, if they told us our mom is COVID positive, now what will we do?
Yeah.
Yeah, so they just gave her the painkillers. And remember, we have gone hospitals. So we just decided, they gave her the painkillers and we came back home.
Yeah.
Yeah,
So, guys, actually, I think at the moment you had to source a hospital from, let's say, Uganda, actually. Yeah. They had to source a hospital from Uganda. And maybe straight away we'll just go. We'll not mention the name of the
yeah,
hospital, but we want to appreciate our neighbors there. Yeah.
yeah. So we took our mom back since they had told us to go back to that big hospital. Yeah, the the option that we had, we saw that in Kenya maybe it is impossible for a mom to get better, so we had another option to go to Uganda. Yeah, thank you so much, Ugandans. That country is so amazing. So we went to Uganda. You can imagine we risked. We went to Uganda, and thanks to that hospital, at least we went there, and I don't know why my mom was not COVID positive. Yeah, so the operation was done. We went there on Sunday morning. On Monday, they just said that they do a chest x-ray, which was done, and they told us the chest is very okay.
Yeah.
So they said on Tuesday she was going to undergo the operation, and they wanted us to deposit around 2 million, 2 million Ugandan currency, and
Yeah.
that was around,
Is it 400,000?
yes,
Yeah. Actually, that one is 40,000. No, 4,000. $4,000. Yeah. Kenyan.
yeah,
$4,000. 4,000. 4,000 Kenyan shilling. Though in America, that one is 4,000. $4,000. Yeah.
yeah. So we deposited the money, and we said that if the doctors have accepted to operate our mom, let's get the money. We requested our good friends. We formed the WhatsApp groups, and
And thank you so
we
much.
thank
If you
God.
are really in that WhatsApp group, we
Yeah,
really want to appreciate you.
the
Yeah, may God
family,
bless you.
yeah, the family and their friends supported us. We managed to deposit the amount on the very day. On Monday, we deposited the money because they said with a condition: if you do not deposit the money, your patient will be just staying here for nothing. So we worked so hard. Our friends helped us. We got the money. We deposited there. The chest X-ray was done, and on Tuesday at 7:30, my mom went into a surgery room. Yeah, and we thank God. You can imagine, just after 1 hour, my mom was out of the surgery room, and the operation was successful, guys. Yeah,
Yeah.
so
So
remember,
maybe you'll tell us what really they found out
yeah,
about the.
remember the stomach was swollen.
Yeah.
You could think maybe she was pregnant. And they found a tumor in her stomach which
Yeah.
weighed 15 kgs. You can
15
imagine.
kgs, guys.
You can
15.
imagine 15 kgs in her stomach, subtract from 40 kgs.
Yeah. You can
Now,
imagine she's
yeah,
only weighing 25 kg.
yeah, so she had 25 kgs, and the
Yeah.
operation was successful. Even my mom was very happy, though she was feeling the pain, but she was very happy that the operation was successful, and at least she felt relieved. She felt relieved, and the doctors told us to clear the bills.
Yeah.
The friends helped us, we cleared the bills,
Yeah.
and after 4 days, I think 3 days, we got out of that hospital from Uganda,
Yeah.
and our mom came back to Kenya. Yeah, so we came back to Kenya. At least, when we went to Uganda, my mom was not eating anything. Her
Yeah.
food was just water, and the amount of water she could take was just 2 sips.
And remember again, she was vomiting at
Yeah,
this time.
vomiting.
Yeah.
If anything gets into her stomach, she vomits. So her food was water and only 2 sips. You can imagine taking the 2 sips and vomiting.
Yeah.
Yeah, so the operation was successful. We came back.
So somebody is asking, maybe the doctors in Kenya, they were afraid of the operation. Yeah, that is why we say we don't want to judge anything,
Yeah.
but maybe it was that fear, yeah, of losing a loved one,
Yeah,
and also we understand that even in any what is it called, in any career, actually in medical field, most of them actually they really fear or they really feel sad losing a patient, and whenever they see it is too dangerous, actually some of them fold their hands, yeah, and some of them they're courageous enough and just go for it, yeah. So actually we don't want to blame them because we really don't know even the rules and regulation about medical, we are only saying a story here actually, yeah.
yeah.
So kindly drop a sweet comment, and actually if you're joining us right now, kindly consider subscribing if you're new to this channel.
Yeah, so the operation was successful. We came back to Kenya and my mom started eating.
Yeah.
It was good news for us, and we knew our mom was going to
Wow.
get better.
Light again, yeah?
Yeah, we saw light.
Yeah.
Yeah, so we started thinking that maybe the doctors didn't want to lose the patient in their hands. Yeah, the Kenyan doctors, and we didn't blame them. Maybe
Yeah.
they feared we could lose our patient. But the operation was successful. She started eating, and guys, after 3 days,
Yeah.
my mom's stomach started swelling again. Yeah, it started swelling. She developed complications. Yeah, after a successful operation,
So
she
that one you
started.
had come back at home, isn't
Yeah,
it?
we had come back home,
Yeah.
and now it was the second wave. She started developing some complications, and she was not going for a long call. You can imagine that. Yeah, my mom was not going for a long call for a long time. Yeah,
Yeah.
so maybe we thought after the operation it's just normal for a person. A
Yeah.
person can take some days before he or she goes for a long call. So we waited for that, and my mom's stomach started swelling. We just hoped that maybe it could get better. We went to a nearby hospital. It was just a small hospital. They started to insert her. The behind part, they inserted some medicine and at least some small. Yeah, she went for a long call, just small. Yeah, and we hoped that she was going to be okay. And they diagnosed her that she had malaria. They treated her, and we came back home. But guys, after 3 days, I
Yeah.
guess, yeah, we went to another a little bit big hospital, which we were earlier there before going to Uganda. So we
Yeah.
told them the operation was successful, but the patient has started developing some complications. We went there with the reason because the doctors in Uganda told us, in case you need a checkup, just go to a nearby hospital. So we went to that a bit big hospital. We went there and they said that they referred us. They gave us a refer to another hospital. Yeah, a hospital which we had never gone before here in Kenya. We went there, we told the doctors the first operation was just okay.
Yeah.
But now, for those who gave us a refer to that hospital which we had never gone, they had done a CT scan.
Yeah.
Again, they had scanned the intestines
Yeah.
and they realized that the intestines had swollen.
Yeah.
That's why she was not going for a long call. They had swollen and they had blocked. So maybe there was some.
Guys, what is that actually? We kindly explain for our girl here. Let us know if really you're a medic and you can really explain something small about that, because she's saying the intestines were swollen, yeah,
And
and
blocked.
and blocked, and so she could not poo. So let us just know actually if how you call it, yeah. What is that actually? Yeah.
And guys, it was just last week, the whole of I think last week, but one that's when my mom went to the last hospital.
Yeah.
Yeah, the last hospital which we had never gone before. We went there and they had given us a refer to that hospital. We explained. So we went with the results, which my mom's intestines had swollen and blocked. So we told the doctors, and they said that she has to undergo the second operation. My mom.
bowel obstruction. Yeah, I is saying maybe it's bowel obstruction. This
Okay.
world, guys, Rose, you went more. Yeah, she went through a lot. Especially, you can just imagine, guys, it's through a very short span. They're walking from, it's like every day you're walking from one hospital to another. Or if you come home, you rest for 2 days, then you go to another hospital. Guys, you can now see why she really needs our support, guys. And if you can support financially, guys, don't even hesitate. Her number is just on the description box. Please just go and just support her. Yeah, guys, it has really drained them. And if you're near, you can really come along and just comfort her. That one is very, very good, and we will really, really appreciate. Yeah.
Yeah, so guys, it was just this month, May, last week, but one, they referred to us to another hospital. It was a new hospital which we had never gone before. So we went there, we showed them the results about the intestines. They had blocked and they had swollen. She was not going for a long call. So they told us we are going to do an operation after. Even they promised a date. So my mom spent 1 week in that hospital even without anything being done on her, but she was given some drips, yeah, the water.
Yeah.
So she was given the drips just to sustain her since she was not eating. You could just force her to eat, but she was not eating. Her food was just porridge, but the porridge was now, if she was even resisting porridge. Yeah, so we were just giving her water just to sustain her, but she was still losing the weight. Yeah, so the doctors told us that there was no blood in that hospital. They told us that's the reason why they have delayed to operate her. And they even told us that they told my aunt who was nursing my mom in the hospital, who was taking good care of her when we were not around. They told her to call people from her home to go and donate blood. We
So,
really.
guys, imagine they had to do that. Yeah. So, actually, they even gave out fare. Yeah. From the people from the village. People will come in large. You can imagine in your village asking people to donate blood. People will come. She has friends all over. So, they came, actually, they had to support with fare because that one might be the main problem in the village.
Yeah.
So, again, the same family supported them with fare to go and donate blood.
Yeah, we
Yeah.
gave, yeah, there are people in our village who sacrificed, who said, who just, they voluntarily came out and said that we are going to donate blood, and we gave them fare. So they went there. When they reached there, the doctor said that, oh, there is no need. We already have the blood. Yeah, but so those people went back home. They say that we have the blood, we've just taken it to that big hospital for screening. Yeah, so we were waiting for the blood to be screened first before the patient undergoes operation. Yeah, you understand this. Before the operation, the patient undergoes operation, she needs to be added some blood since my mom was losing weight and she had not enough blood, so she was to be given a drip of blood before going for an operation. Yeah, and after we inquired from the doctors that we've stayed here for long, but you told us the blood has gone for screening, but it has not yet come. And they told us we don't have enough oxygen. That was the next
Again,
reason.
another reason, yeah, comes up. Another reason just pops up, yeah, that there is no oxygen.
Yeah.
Yeah. Remember, guys, they're really getting to it's
Yeah,
like they're really being drained, yeah,
my
financially,
mom's condition was yeah,
deteriorating, yeah.
and they told us there is not enough oxygen and the blood had gone for screening, so we have to wait. You guys, we waited, we gave ourselves hope, we encouraged our mom that will get better, that the oxygen is not enough, but soon it will be available in the hospital. The blood has gone for screening, but soon it will be here and you'll undergo operation very successfully.
Yeah.
And when the date came, which they had told us that the blood will be here, we also went there again to inquire. But they gave us the third reason that the surgeon, my mom's surgeon had gone for a leave.
Now,
Yeah.
guys, again, the third reason, yeah,
The third reason, they
yeah,
said the surgeon, my mom's surgeon, because she had been given a specific surgeon, and they said the surgeon has gone for a leave. So it was impossible. That was the third reason.
guys, in your country or in your village, does it happen, yeah, that you've been booked for a surgeon, yeah? Do they allow that surgeon to go for leave, or what do they do? Yeah, let me know actually what you really undergo. Yeah,
Yeah, so they told us the surgeon has gone for a leave. There is no oxygen. The blood has gone for screening, and they have not brought it back to that hospital. And they even so we were patient, and we started asking ourselves, now what can we do? What is our next step that we can do to save our mother? And at that night, the nurse came to attend to my mom, and she asked my aunt who was taking good care of my mom when she was in the hospital, and she asked my aunt that, what are you doing in this hospital? What are you doing here? You just accept a refer. You know, in that hospital, after giving the reasons why they are not attending to the patient,
yeah.
they told us that they give us a refer to that big hospital.
Actually, guys, if it could be you, could you accept that? They
We
couldn't
refused.
accept.
Yeah.
Yeah.
So we refused that we are not going back to that big
So there is
hospital.
somebody, let me cut her short. There is somebody asking, actually, are there needs that you really need financially to be supported? Yes, guys, they
Yeah.
really need, actually, some hospital bills are pending. And actually, some of the finances now back at home, actually, remember, right now, she needs to go to school, back to school. Yeah, she really needs help to go and finalize. She's on her final semester, isn't it?
Yeah.
Yeah, her fourth year, the final semester. Actually, she really needs to go and finish her exams. Yeah, and things are pending at school. And actually, even some of the hospital bill is pending. And even, guys, now for the funeral, even what you just put on, guys. Yeah, let's come together and really support our girl. Yeah.
Yeah, so they gave us three reasons. The surgeon has gone for a leave, the blood has gone for screening, and there is no enough oxygen in that hospital. They gave us a refer to that big hospital, but my aunt said, no, we can't go there again. Let's just wait from this hospital. And they said, it's okay if you don't want a refer.
Yeah.
But now, the following day, after they have told us that they give us a refer and we have refused, they told us to stay. But the following day, my mom's situation became worse. The long call started coming from the mouth, and
Guys, have you heard that? Actually, she started pooing from the mouth. Yeah, guys, let me know that condition. Yeah, and actually it is so painful for us. And guys, she's seen her mother being in pain, that today she really accepts and says, God, just be with her. Yeah, may her soul rest in peace. Guys, what condition is that? Let us know actually really what condition is that.
yeah,
Yeah.
the long call started coming from the mouth and from the nose. Yeah, because before it was coming like it's just a saliva, the saliva, but on that day the long call started coming from the mouth, since she could not
Pull
pull
from the,
from the behind.
yeah.
Yeah, so the situation had worsened, and the doctors asked us, what are you doing here? So we had to go back home. We told ourselves that we are not going back to that big hospital. Let's go back home with our mom. And we say that whatever will happen, let's just happen,
Yeah.
because it means that the doctors have seen something and it's not possible. Yeah, so we went back home. We just discharged the patient.
Yeah.
I think 4 days ago, we just discharged the patient from that hospital. It's last week we discharged the patient.
Yeah.
It was on Wednesday or Thursday.
Yeah.
It was on Wednesday. We discharged the patient from the hospital. We came home and we looked for a doctor who could just attend to her by giving her just some drips while in the house
Yeah.
as we wait for God's will.
Yeah.
Because
So guys, let me just ask for them to reduce the music. Continue, Ross.
yeah, so we came back home. Yeah, and we looked for a doctor who could just attend to my mom while in the house. Yeah, but when she was in the house, things became worse because the long call continued coming outside from her mouth and from the nose. So we could not do anything. We just did our best, guys. We did our best. I know it's very painful, but it was yesterday. The doctor has been coming. Yeah. The doctor has been coming to attend to my mom in the house. Yeah, she was giving her drips, but the the veins were not being found. Yeah, so she was struggling. The doctor was struggling to get the veins so that she can at least give her the drips to sustain her. Since she could not eat, she could not drink, maybe the glucose in that water could sustain her. But she was just struggling with the drips. It was today is on
Today is on
Tuesday,
Yeah.
yeah. So on Sunday, the doctor came, struggled with the veins, but she didn't get the veins. She got a smaller one and she tried to give her the drips, but when she tried to
Inject
to
it.
inject the drips, it was it was flowing very slowly, very, very slowly. But the doctor just decided to use the syringe to inject the patient very fast to get that drip. So after that, my mother, she was injected the painkillers. At least she slept. She didn't sleep, guys, at night now. At night.
Yeah.
Before yesterday.
Yeah, before yesterday.
The night before yesterday, I tell you, we didn't sleep. We didn't sleep. There was a lot of long call coming from my mom's mouth and from the nose.
Yeah.
So at night we were just struggling. My mom was crying because she has been crying. The stomach was paining her. Even the throat was better. The stomach was paining her. She could cry. And when you could see her, you could cry. We have cried. But now we say, oh God, may you just do your will. My mom has suffered a lot.
Yeah,
oh
guys,
God.
you can imagine that situation, the mothers who coming from the mouth. And actually, guys, they have used all the finance. And actually, when the medical person was trying to inject, actually it was bursting. Yeah.
Yeah, so yesterday,
Yeah.
it was yesterday morning when the doctor came. She tried to inject her with the drips, but she didn't find any vein. My mom was restless. Her eyes was just showing that this is the end. This is the end. There was no hope. And when she tried to inject her, you can imagine, she was trying to put some drips, but you can imagine the drips were coming out from other parts of the body.
So you can imagine if they inject you from here, if I can just show you, they inject you from here,
and
it
the water
comes out
comes
from
out
this side.
from there. So it was bursting. The skin was very smooth.
Yeah.
And it was bursting.
Yeah.
Yeah, so you can
It
imagine
was kind
that,
of fragile.
yeah, you can imagine the pain my mom was going through. They could inject her and the skin bursts or ruptures.
Yeah.
So yesterday the skin was just rupturing, and even the first drip, the bottle it's just,
I don't know, it heated the bottle or something.
yeah, and it just went up here, and even the injection, it just went up.
Yeah.
Guys, so the doctor just asked my aunt who has been staying with mom and asked, where are the daughters or where are the children?
Now guys,
to
listen
this
to
man?
that one was the last words for her mother to the children. Now remember, she was not talking directly to the children at that time. Where were you, Ross?
Okay, yesterday I was just with my mom from morning.
Yeah.
Yeah, even in the morning, she could just tell me, come and wake me up. So by then, she was not waking up. She had not been waking up since she had lost weight. So
Yeah.
we could just wake her up like a kid.
Yeah.
And if she gets tired, you could just take her back to
Yeah.
rest.
Remember,
Yeah,
25 kg, you can just do
yeah.
it.
So
Yeah.
yesterday, the doctor just told people who are in the room to go outside and asked for the my sisters to come, or the siblings to this mother, and I was the only person who was there. And the doctor said, I want to talk to you. And you can guess,
Now they
she
broke the
said
news.
she said I want to talk to you. And I said, I'm there. My mom was just there restless, and she could not even identify me. I asked my mom, do you know me? I insisted, do you know me, ma'am? She said no.
Guys, that one is very, very painful. Kindly, I just want you to drop a sweet comment for my girl here. And guys, remember at this moment, the mother is telling her she cannot even recognize her. Guys, it's very painful. Yeah. And these are the moments we want to hear, the last moments, the last words of the mother to Rose.
Yeah, so the doctor told me that, okay, I know it is very hard to accept, but you need to accept this. She told me I have played my part. She said it is the end. I have done my part, and let's wait for God's will. And I stayed strong, guys. I cried, but I stayed strong. I told myself my mom has suffered for a long period of time. Maybe let's wait, just go to take her and go rest in peace. Yeah, so the nurse went, she injected her with the painkiller, but the painkiller didn't work, guys. My mom was getting worse. Yeah, the situation was worsening. So the nurse went, yeah, and I felt like I was not okay. My body was not okay. I said, let me go and rest a bit. But even when I went, I was just hearing my mom crying. She was feeling the pain. She was feeling the pain.
Yeah.
It was yesterday on Monday at 5 p.m. East African time when she died.
Yeah. And
It's very
remember the last
painful.
words, she only called, where are the children? Where are my children? And actually, the aunt to Ross said, they are outside. And actually, she had just to go like that.
Yeah, those were the
Guys,
last words of my mom. She asked my aunt, where are my children? And my mom said, they are outside. And she died.
so, guys, that one was actually the moment that Rose had with the sick mother. And actually, today we are saying, if you're really joining, the mother has gone to be with the Lord. Yeah. She's now rejoicing with the angels in heaven. Guys, kindly, I want you to help me console my girl here. And actually, guys, drop a sweet comment for your girl. And guys, for sure, I'm really even tearing up. But actually, guys, with your support, we are really going to be strong for our girl here. Yeah. So please, if you really need to support this girl, she's already put her details on the description box, and actually she'll also share some uh some of the details on the community, on her community. Yeah, so that you can just go direct and support her, guys. And remember, we'll update you all along. Yeah, she really needs you at this moment in time, guys. Yeah,
Yeah.
remember, she needs to finish her school. Yeah, she's on her last semester, guys. And actually, other than being on her last semester, she actually has the bills to pay also for the mother. Yeah, the hospital bill, so that they can release the body and they bury the body. Yeah. Actually, guys, I really, really want to thank you for the great, great support. Remember, here it's Miss Dosha and Rose Kunitz, guys.
Yeah.
And we want to really, really appreciate you. Miss Dosha today is this is Western.
Yes.
Yeah, actually, this is the western part of Kenya. Yeah. And actually, I had to come from Turukana County, yeah, to support our girl here. She really needs us. And actually, here is our girl representing you, all of you. So, guys, I really want you to really just support her in any way financially. If you can support her, please go and just support her. Don't hesitate. And I really love you. And the most thing you can really do, guys, the biggest thing you can do, go and subscribe to that channel.
Yeah.
and just give a sweet comment for your girl. Yeah, like the video, guys. We really, really appreciate you. And we want to tell you that, guys, we are going to promise you that every day we will upload a video to update you on what's going on. Yeah.
Yeah. So, guys, thank you so much for tuning in. For those who joined the live stream, thank you so much. May God bless you. For the new subscribers, thank you so much for joining the team. Welcome to Rose Kunig's team. Thank you so much. And for those who are praying for me, I really appreciate. Just put me in your prayers and I will appreciate. Yeah, I know it happens and it's part of life. I have accepted and I need to move on. Yeah, it's part of life, guys. Thank you so much. Continue praying for me and we will keep updating you guys. Thank you so much, Miss Dosha, for coming. I
Welcome.
really appreciate. It's
Welcome.
not that easy. Yeah,
Yeah.
I know it's not that easy, but thank you so much for sacrificing, for
Welcome.
coming to see me and to comfort me during this hard time. I
Yeah.
know it's very painful to lose a parent, but we have to accept, guys. Yeah, I
Yeah.
have accepted and I'm very strong.
Yeah.
Yeah, thank you for the support. I will appreciate for anything, prayers, financial support, and everything. Subscribing. Kindly go check this girl and let's support her. She creates an amazing content. Subscribe to her channel, guys. Thank you.
Guys, we really need to end this video. Remember, when you're in a funeral, you actually want to give you the Western culture, yeah? And we are hoping that we're going to support our girl here so that she can be able to do it. Guys, right now in the evening, actually, they want to put music, yeah? And actually, it's Luya music. Luya, it's part of the tribe in Kenya, yeah? And actually, that is what I was just going to tell them, to lower the voice a little bit, because right now, people will be coming and just drinking, yeah, tea, yeah. So guys, you can hear, yeah. So we want to stop at this. Maybe our girl will just end the video, yeah. And really, I really appreciate you. Thank you so much.
Yeah. What I can just say, thank you so much for everything. I really love you all.
Yeah.
Yeah. We have to
Okay.
end the live stream.
Yeah, thank you. Bye.
Bye.
Bye.